So I'm confused, Dr. McNamara. You really are an advocate for gender-affirming care, and what I'm hearing from you and other speakers is this is healthy for people. It's healthy for mental health. It's healthy for them in general. So why would you not refer a minor for surgical sex-affirming surgery?
You know, I also appreciate this question because it lends insight into the shared decision-making process. I've never referred a patient for surgery because the patient has never desired surgery who I've cared for. It's all about what the patients want, how that fits into the informed consent model, and how that is, and how that goes along with clinical practice guidelines.
So, I'm sorry. So what age group are you seeing? I think up to 25 or something.
10 to 25.
Yeah, so no age has any of your patients desired to have surgery for their mastectomy, a phalloplasty, a phallosectomy, none of that?
None of my patients have desired that surgery at that moment in time. We
Why?
discuss openly
Okay, so
the desire.
again, if gender-affirming care is what's proper, why have you not recommended that surgery?
I think what I'm trying to say is that I haven't recommended that surgery. I haven't helped facilitate it because none of my patients have expressed a desire for it. That's my
Right, but I'm an oncologist. Patients don't come to me requesting desire for chemotherapy. But I recommend chemotherapy because that's what's best for them. So as a physician, if you think that gender-affirming care is best for your patients, why have you not recommended surgery on any of your patients?
Gender-affirming care does not equal surgery.
I understand. There's a continuum.
That behavior is inappropriate, please.
We need to have some quorum here, so we'll appreciate if you do not do those actions at this point in time. Let's have an intelligent and cohesive conversation, please.
So, Dr. McNamara, I understand there's a continuum of puberty blockers, sex hormones to change the sex, and surgery. And what we've heard from all the other experts is that there's this whole continuum is part of gender-affirming health care. So do you think that the surgery is part of gender-affirming health care or not?
I do think it's part of gender-affirming health care for some individuals.
Okay, but you don't recommend it to anybody, is what you just said.
That is not an appropriate characterization of what I said. I have not had a patient who has expressed a desire for it in my experience.
Again, they may not express a desire, but you as a physician make recommendations to patients based on what you think is best for their overall care. So you have never made the recommendation. Just want to get that on the record. Did you hear me?
Yeah, I have. I can't hear you.
So are you going to answer my question or just not?
Oh, I'm sorry. Did you ask another question? I promise I can only hear about 50% of what you say.
My question was, have you ever, as a physician, we recommend treatment to patients based on our judgment of what's best for their care. So you have never, and so in the continuum of gender-affirming health care, surgery is part of that. Have you?
Yeah.
And so I'm asking you, have you ever recommended surgery to your patients?
I don't tell anybody you need surgery. You should get surgery.
Okay.
That's not how gender-affirming care works. Physicians don't tell patients what they should do with their bodies or their gender expression.
I understand. As an oncologist, I don't tell them I give my recommendation as to what they need. So again, just answer the question yes or no. Have you ever recommended surgery for your patients?
I have. I wonder if maybe we're disagreeing on the definition of recommendation.
Okay, I'm done. Thank you.
When a patient presents with issues on possible gender dysphoria before they get referred to an endocrinologist for further treatment?
I'm actually wondering if I could refer that question to Dr. Dayton, who is an endocrinologist who practices in your state. I feel like she'd be the more appropriate person to answer.
No, but I'm sorry. I want your opinion as an adolescent medicine expert, because when they get to the endocrinologist, they are already affirmed. Am I correct?
Say that again?
I want your opinion as an adolescent medicine expert, because they go to see you or a psychologist before. Once they get to the endocrinologist, they usually go there for treatment. So they're pretty much affirmed when they get there.
I think that that's true.
I was just curious about what's the assessment done in your clinic before they get referred to an endocrinologist. You, as an adolescent medicine patient, you see a teenage girl that is going through issues with sexual identity, gender dysphoria. How do you approach these patients? Who do you send them to when they come to see you? Referred by the pediatrician. So how long does a patient get seen by psychologists, psychiatrists before they move forward, is my question. How long is how in depth is this evaluation of an adolescent, especially females that we're seeing more in the female population that are having this issue, before they move to endocrinologists? Because a lot of the times they go to the endocrinologist and these kids are already affirmed by somebody. So who is doing the affirmation of these children is my question.
We are regulators. That's why we're trying to ask some of these questions. Cases come in front of us. We see terrible things happening every day. So when we're asking some of these questions, it's because this is what's going to come in front of us. I think what Dr. Ackman was trying to get a sense of is, how do we respond when we see cases of 14 or 15-year-old biologic females having mastectomies? Is that in the public interest of the great state of Florida, or is it not? That's what we're really trying to get at. We're asking for your help. So, for example, as a person, I'm asking your personal opinion now. At age, let's say 15, is it an appropriate consideration in your professional experience that mastectomy be a consideration for an individual whom, in your opinion, has gone through all of the requisite antecedent steps?
I'm wondering if I could get this question to Dr. Jansen, one of our additional experts, who is really truly an expert on that process.
Dave, if she cannot answer the question, I need to stop the meeting and take a 10-minute adjournment.
Yes, sir.
Let the meeting stay adjourned for the next 10 minutes. Thank you so much, Doctor.